Bismillah ar-Rahman ar-Rahim. Respiratory bronchiolitis associated interstitial lung disease. RB-ILD. Definition. Respiratory bronchiolitis is a pathological term referring to the accumulation of bronchial pigmented macrophages in cigarette smokers and is asymptomatic in nearly all cases. A minority of smokers with respiratory bronchiolitis, however, develop form of interstitial lung disease known as respiratory bronchiolitis associated interstitial lung disease. The exact relationship between respiratory bronchiolitis associated interstitial lung disease and discomative interstitial pneumonia is unclear. They may be considered as different forms of the same underlying disease, with discomative IB or discomative interstitial pneumonia DIP associated with a more extensive accumulation of macrophages throughout alveolar space. Epidemiology of respiratory bronchiolitis associated interstitial lung disease invariably occurs in current or previous smokers, typically more than 30 packs years. Male to female, approximately 2 to 1. Usual age of onset is 30 to 40 years. Clinical picture usually mild breathlessness and cough, and a small proportion have severe dyspnea and respiratory failure, often crackles on examination. Investigations. Pulmonary function tests often show restrictive or combined obstructive and restrictive pictures with mildly impaired gas transfer. Chest X-ray revealing thick walled bronchi, reticular or ground glass change may be normal, HRCT, centrilobular nodules, ground glass change, thick walled airways, often with associated centrilobular emphysema. A bronchoalveolar lavage typically reveals pigmented alveolar macrophages. The histology in respiratory bronchiolitis associated interstitial lung disease revealing accumulation of pigmented brown macrophages in terminal bronchioles, patchy bronchocentric distribution. These findings are frequently incidental in healthy smokers, and the diagnosis of respiratory bronchiolitis interstitial lung disease is usually made on the basis of clinical and HRCT features. Bronchoalveolar lavage and lung biopsy may be of value in excluding other conditions. The management of respiratory bronchiolitis associated interstitial lung disease include smoking cessation, which is the mainstay of treatment, and corticosteroids are occasionally used, and its benefit is uncertain. Prognosis of respiratory bronchiolitis associated interstitial lung disease. The available data about prognosis are limited and prolonged survival is common, although improvements in symptoms or physiology appears to occur in only a minority of patients. That's all about respiratory bronchiolitis associated interstitial lung disease, RB-ILD.